My name is Cara Lefevre-Tillinghast. This is Pick Up Patient Education. The reason why I chose patient education or the integration patient education technology to focus on is because as a nurse manager, and in my current role, it is obvious that we provide lots of patient education, but we don't necessarily document it correctly. This is, of course, needed for our regulatory surveys that dictate what we should or should not be doing. In addition, effective patient education really can be the game changer as far as how a patient perceives healthcare, whether or not they come back for healthcare, and whether or not they can manage their own disease at home. So as I started to think about this idea, I thought, well, let's just give them access to patient education. So I thought about it with just using a tablet in the inpatient setting. And I realized this might be a good thing for inpatient, but it didn't really address the population overall. So in the ambulatory setting, I thought, well, let's just provide them a link if they have an access to a portal. That way they can use their own smartphone computer and they can log into their web portal and just access patient education. Again, I realized this would give more access to patient education, but again, would it be taken seriously? So then I thought, well, what in healthcare is taken seriously for the most part? And that's when the concept of prescribing patient education came up. As our doctors prescribe us medications, we go pick them up at a pharmacy and then we take them as desired. So I thought, well, let's prescribe patient education, and the patient, instead of going to a pharmacy to pick up, would then go to our technology, whether it be a smartphone, iPad, computer, or in the inpatient setting, an IPC monitor. They could then pick up the patient education, view it, answer questions, and have it document directly back into the system. So to do so, it's really a three-step approach. The first of the three steps is implementation. You have to know what's going to need it in the inpatient and the outpatient setting. You need to then look at how can you actually get the patients to view the education that you're going to prescribe to them. You need to look at the technology that's available: tablets, iPads, smartphones, interactive patient care technology, computers. And then you need to look at the workflow for prescribing patient education. You need to make it look like you're mimicking kind of a medication prescription ordering workflow. Desired approach would be for the provider to actually go into the health electronic medical record. They would place an order for patient education. This order then would become a legal part of the medical record and show that something was ordered for the patient. The order then would go through behind the scenes, and the patient would pick up the prescribed patient education via a link if they're in the inpatient setting, by turning on the TV and it's there under the education manual, or on a tablet that would be coordinated to the interactive patient care TV system. But in the ambulatory setting, they could then log into their web portal, and then they could click their prescribed patient education through a tab. At first, everyone thought that this was a great idea, in consensus of the group that this was going to work very well. The one question that continues to come up is accessibility, especially in the outpatient setting, if people do not use the technology that is suggested. Agree. The good news is most people do have a smartphone these days, so hopefully it would have a bigger impact than not. Framework for innovation. Not going to lie, the upfront costs are pretty costly, especially if you don't have the infrastructure in place. The infrastructure from obviously new television systems that can handle getting an order from electronic medical record, or you would need to make sure that you have a web portal that was already existing to be able to prescribe patient education to have them go. If you don't have this, then you would need to put these things in place first before you could actually prescribe patient education. However, what I will say is once the overall cost of implementation, they would be offset really by the reduction of cost in overall healthcare itself. You'd be promoting proper care, you'd be promoting more effective self-care, increased overall disease management knowledge, and overall clinical care, which hopefully would help to reduce readmission rates, revisits, and then also you'd be meeting the regulatory requirements for meaningful use in the total joint, which would then also help with reimbursement. As far as access, as said before, and as raised in the class awareness, accessibility could be a challenge in the outpatient setting. In the inpatient setting, because you're in the hospital, you would have access to prescribed patient education via a tablet or via your IPC. In the outpatient setting, you would be relying on the person to have either internet capabilities as well as a smartphone that would be able to go to a portal, log in, and then be able to view their education. So the good news is most people have a smartphone, as I said before. The bad news is you can't dictate how they're going to use that smartphone. The last thing is quality. Implementing a fully integrated patient education system has shown to improve patient satisfaction, patient perceptions of doctor communication, and understanding of their own disease process. This has also helped them improve efficiencies with admissions and discharges in the inpatient setting, and it really has helped to change behavior in managing patients managing their own care and improve team efficiencies, which has also shown to reduce readmission rates. So, do you know what CHF, diabetes, CVA, TIA mean? You as a healthcare provider probably do, but do your patients? Often in healthcare, too little time is spent on educating our patients. Busy schedules, reduced length of stay, and demanding needs to keep moving have left patient education as last in a list of growing priorities. Every patient deserves to have high quality, individualized patient education. Prescribing patient education to a patient, just like an order, gives the patient the opportunity to pick up their education from a TV system, tablet, iPad, computer, or smartphone. Why prescribe patient education? The same reason patients are prescribed medications. It is an individualized approach. Providing the best education to patients helps to improve outcomes, satisfaction, and efficiency in the healthcare provider. Prescribing also documents information into the electronic medical record and is discoverable for all to see. If you believe that patient education is important, but you have little time to provide it, ask your healthcare system administration team to investigate what it would take to prescribe patient education.